Hi, I'm Dr. Karaaltin from Karaaltin Clinic. I'm going to talk a little bit about a myth about how much volume of fat should be transferred to a certain area. Actually, the majority of our patients, they ask, please put as much as you can, or can I receive as much as fat I can? These questions are, to be honest, in the view of the patient, is quite normal, and I understand. But to be honest, it is not right and it's not scientific. We know, I explained in another video, the science behind fat transferring and how does it work and how does the fat cell survive when you're transferring it into the receptive area. But on the other hand, there's another principle which is more or less related to physical basic science, is that we're transferring those cells into layers into a specific dimensional cell actually, or a space, let's say. So that space has a certain dimension and every patient is unique. If we're transferring the fat to the buttock area, every patient has a certain dimension of buttock that we can create a pocket and transfer the fat into that area. So that area, the definition of the area, the dimensions, is defined with the bone framework, the pliability of the skin and how much it can expand, and the width of the muscle, blah, blah, blah. So the dimension in every patient is unique. And through those dimensions, the amount of fat that we can transfer is limited. We cannot put 1.5 liters in 1 liter of space, because what happens if we do that, if we do overfilling, I mean, I'm not talking about overcorrection because you can go over the 10 to 20%, but if you go overfilling, what happens, you're increasing the compartment pressure inside that space. And when the compartment pressure increases, it will occlude, it will compress the vessels in the vicinity in the area where you've transferred the cells. And when those vessels are occluded, you're going to deprive the area from nourishment and circulation. And then the grafting process, the bridging of the vessels, is going to be disrupted. And that means the fat that you've transferred, you might lose it all. So we have to be very, very crucial when we're transferring the fat in a certain space of area. And every patient is unique. Actually, we're using a very good technology called the Vibrosat technology, and we're using the lipostat pump. Actually, the pump is a little bit of a smart pump. When you pump the fat, as you remember my previous videos, we spray the fat inside the compartment. And once the compartment pressure approaches the level of, let's stop here, it gives a back flush. And it tells us, please stop, do not inflate, do not put extra fat inside. If you're going to put that, then you're going to create an overpressure compartment, and that means we can lose all the cells that we've already been introduced inside. So every patient has a limit, and every patient is unique in dimensions and space. Of course, we can do the measurements and we can give an approximate amount that we can transfer upon our knowledge and experience and hundreds of patients that we've done, but more or less we're relying on the pump itself, because when the pump gives us the back flush, it says stop, because dimensions itself is not sufficient to define the amount that we can transfer. Skin pliability and the tissue pliability is also a factor. So in some patients, they have a very pliable skin, so you can add extra fat volume. Some patients, they have very tight skin, so the volume that you can create, the space that you can create is limited. So all of these different factors that might affect the amount of fat that we can transfer to a certain area of the body. And to be honest, this rule is for all areas of the body where you're going to transfer the fat. It's not just limited to the buttock area. But I just wanted to explain it in a more specific way for our patients for the advanced safe BBL technique. Thank you very much.